Today, I'm going to talk about syphilis. So, this is a notorious sexually transmitted infection that probably a lot of the general public doesn't know that much about. So, syphilis is a bacterial infection, and the name syphilis comes from a poem in the 1500s about a shepherd named Syphilis who angered the god Apollo, who then plagued him with this disease. That's where it comes from. The origins of syphilis, we think, are likely to be in the New World. When you see outbreaks of syphilis occurring in Europe, it is after the voyages of Christopher Columbus, and there is some data to support that this was something that was endemic in native populations in the Americas and then spread to Europe. So, what makes syphilis so unique is it has multiple different stages. It's not just an acute STI. So, it starts with what we call a chancre, kind of a lesion, a painless lesion that might be in the genital area. It could be in the mouth. It's very infectious. That's how it usually presents when people are infected. And if you diagnose it, you can treat it at that point, and that's the end of it. But often these might get missed, especially in females, and then it disseminates and you get secondary syphilis, which several weeks after the initial infection, you'll get fevers, chills, muscle aches and pains, and this characteristic rash on the palms and soles in some people. They're very infectious when they have a secondary syphilis. You can also treat it at that time with antibiotics. Then after that, it goes into what we would call latent syphilis, where syphilis can remain dormant in your body, but still create havoc. People can get neurosyphilis, which can lead to certain neurologic deficits in the way that you move around or the way you think. It can have neuropsychiatric symptoms. It can get into your eye, and you can get ocular syphilis. And this sometimes is diagnosed, but we will treat it again with antibiotics, but sometimes the damage is already done if you're in the late stages of syphilis. And many famous people died from the late stages of syphilis, including, I think, Beethoven and others. The other issue is that a mother can pass this to a child, and that happens when they're not screened for syphilis. And congenital syphilis can be very devastating to a newborn. And in the United States, we have thousands of congenital syphilis cases occurring, which really shouldn't be occurring. There's probably about 200,000 or more cases of syphilis in the United States, but it's those congenital syphilis cases that tell us that something is wrong with our testing. And you do tests for syphilis with blood tests that will tell someone tell you whether you're exposed, how much the exposure was, or how severe the infection was, or how dominant the infection is in your body. But this is something that people should keep in mind and ask to be tested for when they're getting tested for other sexually transmitted infections.